Hi, this is almost everything you'll need to know about the clavicle. This is the right clavicle. The clavicle is also known as the collarbone and is the more anterior bone of the pectoral or shoulder girdle. The clavicle is a long bone, which means it has a long shaft and expanded portions at either end. On the medial end is the somewhat bulbous expanded portion, which is the sternal end of the clavicle, and the lateral end has a more flattened expansion, and that is the acromial end of the clavicle. The sternal end is bulbous in appearance and carries the articular surface for the sternum. We're not quite seeing that here because it points a little posteriorly, but that articular surface forms the sterno-clavicular joint as it attaches to the sternum, or the SC joint. And the lateral articular facet, which we can see here, attaches to the acromion process of the scapula, and that forms the acromio-clavicular or AC joint laterally. Most of the shaft of the clavicle has this cylindrical appearance, but it does become progressively more flattened over its lateral third. The other interesting features of the clavicle, almost all are on the inferior surface, so we'll turn it over, and again we see the sternal end here. We can appreciate some of the articular surface that is carried medially. This flat roughened area here is the costal tuberosity, and that's for the clavicular attachment of the costo-clavicular ligament, a ligament that runs from the first rib, which is just inferior to the sternal end of the clavicle. This very prominent groove in the middle third of the shaft is the subclavian groove, which is the groove for this muscle subclavius. Again, that muscle arises from the first rib and extends laterally and superiorly to attach to the clavicle here. This bony prominence is the conoid tubercle, and that's the site of attachment of the conoid ligament, and the rough line that extends laterally from it is the trapezoid line, which is the site of attachment of the trapezoid ligament. And both the conoid ligament and the trapezoid ligament extend inferiorly down to the coracoid process of the scapula, and together they form the coraco-clavicular ligament. So trapezoid ligament plus conoid ligament equals coraco-clavicular ligament. And again, we can just see the articular surface for the acromio-clavicular ligament here. If we look at the clavicle attached to the other skeletal elements, we see the sterno-clavicular joint here and the acromio-clavicular joint here. I'll draw in those ligaments for clarity, hopefully. So the conoid ligament from the conoid tubercle stretches down. It's conoid, somewhat conical in shape, and attaches to the coracoid process here, and alongside it the trapezoid ligament from the trapezoid line, forming a trapezoid shape. Everything in anatomy is named for a reason. It's just that the reasons are somewhat obscure sometimes. The costo-clavicular ligament from the first rib running to the costal tuberosity of the clavicle, and subclavius also running from the first rib and into the subclavian groove, somewhat like that. The first rib here forms the boundary between the internal thoracic structures and the structures that lie between the upper limb and the trunk. So in this area here, which is known as the axilla, and more of that anon. One final view. So we see the clavicle here again attached to its neighboring bones. the sterno-clavicular joint, the acromio-clavicular joint. We note the underlying first rib. The clavicle forms the anterior boundary of a triangular skeletal structure called the cervico-axillary canal, and the other elements are the spine of the scapula, laterally and posteriorly, and the first rib medially. So this triangular structure, I'll draw it on the left as well, is the cervico-axillary canal, and that protects the delicate nerves and vessels that are running to and from the upper limb. So specifically we have the subclavian artery, literally the artery beneath the clavicle, which arises out of the thorax on the right from the brachiocephalic trunk, which arises itself from the aorta, and crosses the first rib over the top of the first rib, changes its name to axillary artery as it passes this lateral border of the first rib, and then descends into that tissue space, into the axilla, to supply the upper limb. The vein that accompanies it, initially the axillary vein, arises from the axilla and crosses the first rib in the opposite direction, of course, in front of the artery, and descends into the thorax and joins the internal jugular vein to form the right brachiocephalic vein in this case. So we see the clavicle does a very good job of protecting those structures as they cross the first rib, where they would otherwise be quite vulnerable. Also, the cervico-axillary canal is the entrance to the axilla by the neurological structures, specifically the brachial plexus, which commences from the cervical cord from the C5 to first thoracic nerve roots, and descends and travels laterally to approach the axillary artery via the cervico-axillary canal, and it's also protected by the very impressive trapezius muscle, which arises from the partly anyway from the spinous processes of the cervical vertebrae, and attaches to the lateral part of the clavicle as well as along this part of the scapula, the spine of the scapula, and provides protection for the nerves in this way. So that's almost everything you need to know about the clavicle. You should consult your textbook for additional information, but I hope that's been informative, and we'll see you again soon. Enjoy the rest of your day.